So I appreciate your work on that. I am a little concerned that it's taken the state, if it's going to be 2 to 3 more weeks, 2 months to correct the discrepancy. I think that's absurd. And that is in no way reflection on our local Department of Health. But if you see a problem, you should fix it quickly, not take months during which individuals may have died as a result of the states dragging their feet. Have we figured out who was asleep at the switch yet at the state level who wasn't aware of this discrepancy until we pointed it out?
Mm-hmm. Well, I will say that, I've worked very closely with the State Health Department leadership as well as the governor's office, and General Scott Sherman has gotten involved in early April when the mayor and I had a call with him. And so I can just tell you that there is they tell me that they are committed to increasing our vaccine supplies. And, I trust in that. I mean, I don't know, exactly what occurred, but I think that along the way, when vaccine supplies were available, the priority groups were various different occupations. So it was healthcare and first responders, and I know that what has been said at the state level, that there are more healthcare workers and first responders, I guess, in the Denver County. But I also know that the director of the State Health Department had written an editorial kind of, providing a framework around how decisions were made. But I don't, I am focused on the response and the recovery, and putting my energy into, when we do get vaccine and the increased supplies, of responding very quickly and making vaccinations available. So that's where my focus is, and I want to assure you that all throughout the process is that I have to stay focused, and there's only so much energy that I can dispense related to the enormity of every aspect of this, but that's where I'm staying focused.
So I appreciate that. That is where the focus should be. I'm not criticizing your focus at all of this. I'm just saying that at some point, part of the responsibility of leading an organization is, when it screws up, figuring out what happened, why, and what you're going to do to ensure it doesn't happen in the future. And I'm certainly aware that folks in Denver are more aware of things in Denver than they are the rest of the state, but that is something that is important for the state leadership. It's one of the reasons when I was secretary, I was in every county clerk's office, because you have to be aware of what else is going on. And I'm very concerned that they wouldn't have noticed this discrepancy until we pointed it out from down here, because if you were in charge of something that is involved with saving lives, you ought to at least have the awareness to make sure it is distributed equitably and fairly across the state. So